The living tradition of Chinese medicine dates back around 2,000 years. Since then, Chinese medicine has been developed and transmitted by scholar physicians whose observations and interpretations have been debated and recorded. The earliest and most comprehensive collection of medical texts, the Huangdi Neijing, is thought to have been compiled during the Han Dynasty that stretched from 202 before the Common Era to 220 Common Era. Zhang Zhongjing, who lived in the Han, developed a theory of how cold diseases progress through the body, well documented in a book, Treatise on Cold Damage. Hua Tuo, 220 to 280 Common Era, was able to diagnose a dead fetus in the uterus through feeling the pulse and administered herbs to expel it. Huang Fumi, 265 to 316 Common Era, had a library of 10,000 volumes and was skilled in prescribing and pulse diagnosis. He is the author of the AB Canon of Acupuncture. Teaching was primarily through a lineage system of direct transmission from master to disciple. In this image can be seen the combination of theory, students were expected to be able to recite the medical text by heart, and practice, here showing acupuncture needles. The written record has been key to the development and progression of Chinese medicine. This is the back cover of the complete, secretly transmitted text on acupuncture and moxibustion from about 1160 to 70. Here the first page of the classified book of effective prescriptions from the Ming period, 1368 to 1644. The body that the Chinese saw in that great flourishing of ideas in the Han period was a resonance between the macrocosm and the microcosm. In this Taoist map of inner luminosity from the Tang dynasty, the internal anatomy was a mirror of the energies of the mountains, rivers, lakes, forests, fire and stars. It was a landscape of balance. Each organ played its part in the functioning of the body, and interconnections, well documented in the Huangdi Neijing, were more important than gross anatomy. While the lungs are described as having 6 lobes and 2 ears and located next to the third spinal vertebra, the main acupuncture point to treat the lungs, they are also seen as a delicate organ that acts as a canopy over the Zhang viscera. As the understanding of the workings of the human body was going through great development, it is interesting to note that what the Greeks saw were muscles and bones, while the Chinese gaze focused on channels. It is through the channels that qi is connected and distributed throughout the body, to maintain life, and through the channels that the internal organs manifest at the surface. The lungs manifest in the upper body, and the upper limb and connect to the intestines below. Place and depth were key to this view of the body, and hence the 4 methods of diagnosis. By gazing at the surface, the inner working of the body and illness could be understood. The 5 colours on the face manifest the waxing and waning of the wuxing. Each internal organ is manifest in the eye. The white of the eye is associated with the lung and metal. Tongue diagnosis, developed at a later period in history, manifests heat and cold, repletion and vacuity, and maps onto it the internal organs. Palpation of the pulses has been practiced in China with developing and profound understanding for 2,000 years. Again, place is critical. What is felt depends on where it is felt, and so we have defined positions that relate to the practitioner, the location of the illness, and qualities that tell of the state of the qi and blood. The use of needles to treat disease has been well documented. With more malleable materials, various types have been developed. The filiform needle, the thinnest needle as fine as a hair, was used to regulate and free the flow of qi in the channels. The long needle was used to treat wind-damp blockage, with deeper needling was needed. There were needles for drawing blood, moxa for warming and driving out cold. Books describe the detailed points to be used for different diseases and the nuances of differing signs and symptoms. Herbal medicine was the other major treatment modality, with exhaustive and detailed descriptions of plants, animals and minerals, and again how they treated illness and how they could be combined and modified to meet the individual manifestation of the patient. The collection and identification of plants was a serious pursuit. The earliest medical texts describe the role of exercise for maintaining health and treatment of pain. This image comes from the Wawangdrei tomb, sealed in 168 before the Common Era. Many of the exercises follow the postures and movements of animals, such as the bear and the crane. This exercise for treating low back pain is called Black Dragon Swings Its Tail. The role of diet for achieving longevity was also critical. The diet of the immortals was the name given to one of the 4 genres of ancient Chinese medical literature. As a living tradition, Chinese medicine has changed and adapted over the years. So what does it look like today? How is it taught and practiced? The scholar physicians of our day work in departments of universities in most countries throughout the world. Resources are pooled and team teaching is common. While the number of texts has proliferated, I'm not sure in our library we are up to the number that Huang Fumi held. Many books have been translated into English, and more are being written by academics in the Western world. Students have access to a great range of books and information, now made easier with access to the World Wide Web. Students learn in large lecture theatres, often across disciplines, and individual research is part of the course. Small group teaching, especially for clinical skills, is very similar to the old apprentice system, though I'm grateful for this, it is not one of lineage. Here students are being supervised in the teaching clinic. Graduation, interestingly, harkens back to the dress of our famous scholars Hua Tuo and Zhang Zhongjing. While the teaching of the function of the organs has not changed, detailed anatomy is now part of the curriculum. The lungs are still the delicate organ, amplified here in this detailed dissection, and X-rays can be used to enhance diagnosis. The detail of the eye adds to our understanding, but does not change the treatment. Over the years, channels have become much more detailed, with the internal muscles, blood vessels, nerves and bone structure aiding point location and supporting safe needling. When it comes to diagnosis, the four methods are practiced today as they have been for 2,000 years. Pulse taking is a key skill students must learn. In some places, attempts are being made to record the pulse through electronic means. Tongue diagnosis and the learning of it is enhanced by the availability of good quality photographs as a means of recording and comparing over time. Palpation of the body plays a major role. New methods of diagnosis add to the picture we are wanting to build up of a patient. Blood pressure and monitoring of heart rate and respiration are two that are common. When it comes to treatment, the filiform needle is still the main one used, however now made from stainless steel. The guide tube insertion method is a more modern addition, as is ear acupuncture, developed in France and now used routinely in China and the rest of the world. The use of electroacupuncture is also a 20th century addition. Moxibustion, in its various forms, has changed very little over the years. Cupping, as a way of stimulating circulation of qi and elimination of cold, has moved from bamboo cups to glass, and now has techniques to systematize the exact vacuum effect. Herbal medicine starts with the same ingredients, it always has, and students are taught tried and tested methods of dispensary. But new extraction methods are leading to different methods of administration of herbs, and major research into the isolation of active ingredients is going on. Treatments such as massage and Tai Chi, here a group of patients with Parkinson's disease, continue to be a major part of the repertoire of the current practitioner of Chinese medicine. As you can see, Chinese medicine has changed and adapted over time to different contexts, but is still quite recognizable. It is a living tradition that has survived for more than 2,000 years and continues to offer a unique understanding of the body and relief for many patients.